Welcome back, learners. We have been discussing from block 3 from unit 3 health and nutrition of the tribals. So in this session we'll be discussing on the topic what are the health strategies for the tribals. The tribal groups of India have specific problems. Some of those are built-in problems of these communities and some are imposed upon them, which jeopardize their overall development and progress inclusive of their health. Therefore, the healthcare delivery system should be such designed for each specific needs and problems by bringing their personal involvement. The NGOs working for the development and welfare of the tribal, collaboration of voluntary organization, NGOs should be secured to integrate and coordinate their activities and services with the health development plan of the government for the tribal population. The following strategies may be actively followed by NGO functionaries for the health development of the tribal population. So let us see what are the strategies one by one. Firstly, talking about the socio-cultural and environment awareness. The formulation of realistic development plans based on needs of specific tribal group, adequate understanding of socio-cultural background of different tribal groups, perception of diseases, their beliefs and taboos, study of health culture at micro level, positive tribal cultural values, traditional skills should be encouraged and to be inducted to mainstream of life. In most of the tribal communities, there are a number of folklores related to health. Documentation of folklores available in different cultural systems may provide the model for appropriate health and sanitary practices in a given ecosystem. The efforts on sanitation, personal hygiene, provision of safe drinking water, dispelling the misbeliefs and taboos, magico-religious practices, etc., awareness of hazards of consanguineous marriages and so on. Then talking about another health strategy is nutrition. This is very important for the tribals. By developing the horticulture with emphasis on local fruits, introduction of integrated child development scheme in all blocks, basically strengthening the existing government resources, then development of poultry and fisheries, study of nutritional status and physical growth. Moving on to another important health strategy pertaining to maternal and child health. 100% immunization of mothers and children with special emphasis on measles vaccination, strengthening the services of the existing health programs related to mother and child health and ensuring the services are accessible and available, distribution of vitamin A, oral rehydration therapy and education. Moving on to another strategy, that is the genetic disorders, mainly to hold training camps of medical staff for awareness of genetic disorders and marriage counseling, training of laboratory technicians in the technique of simple genetic tests like sickling, G6PD enzyme deficiency, etc., screening of villagers for sicklers and G6PD deficient individuals. Identified persons can be tattooed with dot marks. Then finally, another strategy, health education. This is very important. Chapters on horticulture, poultry, immunization, common diseases, genetic disorders, ORS, hygiene, sex education, etc., may be included in the middle and high school syllabus. Distribution of leaflets and playing of audio and where possible video cassettes, preferably in local dialects, in weekly markets, go-tools, schools, etc. Development of effective communication strategies on health education and healthcare among tribal groups. There are also other few strategies like training, organization of short-term orientation courses on tribal culture for health workers at district and subdivisional headquarters, identification of traditional health practitioners and their training in public health, training of tribal girls as nurses, midwives to generate better response, strengthening of tribal research institutes which may serve as base laboratories, and other measures like in difficult tribal hilly areas, mobile health teams should be formed to provide professional services for medical care and research and collect health information. In tribal areas, huts, weekly market centers are the focal point of activity. Each hut should be provided with a primary health center. As some primitive tribal groups are reported to be stagnant or declining, effort should be made to delineate the causative factors. Now let us look at the principles of healthcare for the tribal people. Designing and planning of healthcare for tribal people need to be guided by the following principles. Firstly, justice and responsibilities. It is the constitutional and moral responsibility of the government and of the society to do justice to this vulnerable segment of the population. Provision of healthcare to the tribal people cannot be derived from the market principle of financial returns or profit, but should be only on the principles of justice, rights and equity. Then the next principle is appropriateness. A uniform and rigid model of healthcare is definitely inappropriate. The healthcare delivery and content must be appropriate to the needs and culture of each tribe and its locality. Another most important principle is autonomy. The tribal people want to be autonomous so as to be able to preserve their identity, their way of life. Autonomy is also necessary to ensure that the healthcare designed or planned for the tribal people is appropriate to their needs and culture. The next principle is decentralized planning and administration. This means more role and power to the basic units such as the Gram Sabha, the Panchayat institutions and the district. However, enormous capacity building efforts will be required to enable these units perform better. Acceptable and culture sensitive, this is another principle which is very important for the tribals. A contentious but important issue is how to accommodate the indigenous medical system, the providers and the therapies without sacrificing the scientific principles and methods of public health. And another principle is another principle is university. All tribal people living in the scheduled areas or outside should be covered by appropriate healthcare models. For those living in non-scheduled areas, special provisions must be made at the household level. Accessible in view of the problem of distance, physical and cultural access to healthcare is of paramount importance. Healthcare must be designed and delivered to ensure access for all. This will mean that infrastructure, human resource and service delivery should be as near as possible. Access can be ensured in several ways, like healthcare institutions should be more in number at a lower population ratio. For this, we will have to move beyond the PHS and tribal areas. Then human resources, they should be more in number and placed at a short walkable distance. This means each tribal village and hamlet should have a trained community health worker and volunteers. This would also mean that majority of these workers must be from within the community and community based. Then outreach service and mobile care. Knowledge and skills transfer. Health literacy among tribal people is low. Behavior change communication and health education are important. So these should be done in a culturally sensitive manner. Then technology. The use of information technology and mobile phones can bypass the distance and enable a quantum jump in access to knowledge. There are also other 10 important health problems in tribal area which needs to be addressed. First, to control malaria in the tribal population. The 124 districts with only 8% of the country's total population but 49% of its tribal population accounted for 46% of the total malaria cases. It is necessary to reduce the parasite incidence in tribal districts, ensuring adequate human resources, introduction of surveillance system to check the spread of vector through abandoned mines, etc. strategies may be adopted. Then reducing the prevalence of malnutrition among the tribal population through ensuring food security, use of local foods, strengthening of ICDs, nutrition counseling of mothers built on the knowledge of local foods and food habits. The focus of ICDS must shift from a center based service to a home based reach out during the period of pregnancy and the first 2 years of childhood, prevention and treatment of infections, management of severe malnutrition. Then reducing child mortality among the tribal population, ensuring safe motherhood and health of the women from tribal communities, providing family planning services and infertility care, controlling the use of addictive substances and providing de-addiction and mental health service, sickle cell disease, ensuring timely treatment for animal bites and accidents, health literacy in tribal areas, health of children in ashram salas. Now let us look at the integrating traditional tribal medicine into primary health care. Let's see what are the objectives. To study, document and test the tribal health traditions, particularly tribal systems of medicine of different tribes. To integrate tribal medical practitioners into primary health care. To empower the tribal people to adopt healthy practices to enhance their capacity for self-care. To enable the tribal people to enjoy the economic benefits of their traditional knowledge. To encourage the tribal people to access modern healthcare infrastructure. Now, when we see the knowledge, research and data on tribal health, as of date, there is scanty data and information on the health culture, system and health status of the tribal population in the country. Research on tribal health should encompass studies of the knowledge, attitudes and practices in the tribal people. What do they want? Why? Then study of tribal medicines and practices and scientific evaluation of the same. Epidemiological studies like study of morbidities and mortality that affect tribal populations, the rates and the trends and the intervention studies. The healthcare delivery systems in tribal areas, the priorities, inputs, coverage, quality, utilization, barriers and bottlenecks and outcomes. The policy, governance and financing. Now let us look at what are the challenges. Undertaking innovative solutions research on grand challenges in tribal health, to collate and make available existing data on tribal health, to generate knowledge and disaggregated data on various aspects of tribal health, to document and test tribal health traditions, particularly tribal medicine, strengthening the institutional mechanism for tribal health research and allocation of sufficient funds, and protecting the rights and access to knowledge for tribal people and tribal communities by way of strengthening ethics oversight, protecting knowledge rights of the community, monitoring, supervision and impact of evaluation of health programs in tribal areas. Now to sum up, if we look at the general health status of the tribal is poor as compared to the modern society. They may suffer from some distinct health problems, not because they have some specific type of health, but because of specific placement in difficult areas and circumstances in which they live. Also because of the widely varying geoclimatic and ecological conditions, and different tribal societies, depending on their uniqueness, may have some specific health issues and problems of their own. We often tend to forget that till a few decades ago, the small tribal population did not exert any undue pressure on land, forest and other similar natural resources. The tribal health in India unfortunately was never taken seriously. The nutritional problems of different tribal communities located at various stages of development were full of obscurities and a very little scientific information on dietary habits and nutritional status were available due to lack of systematic and comprehensive research investigations. Though some intensive field work has been done by social scientists, but some of the studies treated the problem of the tribal health in peripheral and casual manner. So, for a meaningful understanding of the tribal health, it is important to understand the people themselves, their indigenous medicines, and understand how, under the existing social, economic, and cultural setting, these needs can be best met to the satisfaction of people themselves. So, learners, we have come to an end with this unit. Hope to meet you in the next session with new unit. Thank you.